From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and it is time to visit with Dr. Ole Olson from Central Iowa Neuropathy to let you know about how they treat your neuropathy pain. And we're going to give you the band test again. We're going to show you the band test. Dr. Ole, good to see you. Thank you for being here.
Absolutely. Thanks for having me on again.
All right. Last time you were here, we did the band test and showed people what peripheral neuropathy and how it could affect you is all about. And we're going to do it again today.
Yeah, absolutely.
Okay.
So if you at home want to join us, get a rubber band.
Got it. Okay.
And what you're going to do is just take it and just wrap it around the end of one of your fingers.
Okay. We just did it here.
There we go.
Everything looks fine and dandy. Yep. So while we're talking, this is like simulating what could be happening with peripheral neuropathy, which is...
Yes, so peripheral neuropathy is basically just damage to the nerves outside of our central nervous system.
Okay.
So your brain communicates down through your spinal cord, and then once it leaves the spinal cord, it's no longer the central nervous system, it's the peripheral nervous system. That's the nerves going down your arms, into your hands, into your fingers, down your legs, into your feet and toes, even those ones going to your vital organs.
All right, so now we understand what peripheral neuropathy is, but what are some of the things that people need to pay attention to that might be indicators that this could be peripheral neuropathy?
Yeah, so there are many symptoms associated with this, and it's all over the board. So this is what gets kind of complicated with it, is there's a lot of things that mimic other issues, which is why it's so important to get tested to see if it is neuropathy.
And it's difficult to test too,
yes,
right?
Yeah, absolutely. So a lot of times people think that maybe it's just plantar fasciitis, or maybe it's just this, that, or the other, and so you got to make sure you rule out what actually is going on, and which is why we do the tests that we do. But common symptoms are typically pain is one that a lot of people associate with neuropathy, and it can be like a sharp pain, like stepping on a tack. It could be electrical shooting kind of pain. Sometimes it's freezing cold, or even super hot burning type pain.
Right.
But what people often don't know is that sometimes it has no pain at all. It could be more just numbness, tingling, that sort of dead, heavy sort of feeling.
Okay.
Could be balance issues, coordination issues.
Now, how does that come into play? Why would it be balance issues?
Well, there's nerves all through your body that are communicating back to your brain. Remember our central nervous system? Mm-hmm. That's what coordinates everything. So when we're speaking, my brain is telling my mouth what to say, how to do it, right?
Okay.
So when I'm walking, my joints and my muscles are constantly telling my brain what's going on in that area, so it knows exactly what to do, right? So if I bend over to tie my shoe, if I don't contract and relax the appropriate muscles, I'm going to face plant.
Got it.
And so once there's damage to the nerves, those nerves aren't communicating back to your brain. Now there's a disconnect and you're not getting the right information. Now all of a sudden you start getting a little more wobbly.
Yeah, even if we talked about numbness being one of the indicators too. And if you're, like say the bottom of your feet, for example, are numb and you don't know how you're balancing yourself, you're not feeling if you're tipping over too far.
Yeah, if you've ever gotten up in the middle of the night and you're walking through your room, sometimes you step on maybe a shoe or a dog's toy or something that kind of throws you off.
Yeah,
you just weren't ready for it. But luckily, if you have that input from your brain, you can usually catch yourself.
Got it.
Or other times you step off a curb and all of a sudden you fall to the ground because your nerves didn't respond quick enough.
Right, so that's something you really need to pay attention to. But what is the cause of this? Why are we experiencing this change in our bodies?
Yeah, and this is what's so concerning, is that the main causes of neuropathy are only getting worse right now. So diabetic neuropathy, that's the most common, right? Diabetes is only getting worse in our country. The second most common type of neuropathy is chemo-induced neuropathy. Once again, more and more cancers diagnosed every single day. The last one is called idiopathic, which is just a fancy doctor word for, we're not really sure.
But it's happening, yeah.
But we have a lot of categories in there that really seem to fit the bill. We've got about 20 different medications that can cause damage to nerves, including statin drugs for cholesterol, which is a very common drug. Exposure to different chemicals and toxins. But really, when it comes down to it, all these different neuropathies have one thing in common: decreased blood flow.
All right, and that's what we're showing you here. And you can see the blood flow here. And what happens when you don't have blood flow around the nerve, it will break down. The nerve itself will break down. And that's what you have to fix.
Yeah, so as you can see in the screen here, the blood flow, these micro blood vessels. So even people that have been told their blood flow and their circulation is fine, what the doctor's looking at typically are the larger, major arteries coming into the legs and feet or the arms and hands. We're looking at the micro blood vessels. These vessels come in, they wrap around the nerve. What they do is they bring nourishment, oxygen, nutrients, the things that nerve needs to thrive. Mm-hmm. First thing happens is the myelin sheath, or your protective layer, starts to break down. Once that protective layer breaks down, now the nerve's more at risk, and now all of a sudden the nerve starts to break down. And pretty soon we're not getting that smooth transition of information to and from the brain and the body.
And you want better proof as to what happens when you don't have blood flow going in anywhere? Here, let's take a look at this.
So take a look at your finger. If you put a rubber band on at home, you can take a look at your finger and you can see the difference in
Look at
color.
the difference in color.
See how dark that is?
Wow.
So that's just from a couple of minutes. So imagine that this nerve this nourishment to my nerves are being choked out for days, weeks, years. I mean, I've seen people that have been dealing with this for decades.
Wow.
Imagine what's happening to the nerves at the end of that, where those blood.
But this can be treated, and it can be treated at Central Iowa Neuropathy. People want to sit down and learn about it. What's the best way to do that?
Yeah, if you call our office right now, we actually have an upcoming seminar.
Okay.
Patient education is our first and major focus in our office, because people, if they don't know, they don't know, right? Mm-hmm. And if most people are told there's nothing they can do and they just have to live with it, and what they do is they just keep going, getting worse and worse, taking more and more medication, and just not getting to the root cause. So come on in. We've got a free seminar. The first 15 callers, because these things fill up fast, first 15 callers get to come to the seminar for free. We're going to give them a book for free as well. We always welcome guests. So if they have a spouse or
bring them along,
bring them with them.
All right.
Because the more people understand what's going on, the better chance they can get well.
There's the number, 207-9066, area code 515. Learn about what can be done, and it can be done at Central Iowa Neuropathy with this guy, Dr. Ole Olson. Thank you, sir.
Thank you.
Appreciate it.